Understanding and addressing individual and group behavior is essential in order for teams to meet their goals and serve their patients. The AHA's Physician Alliance has interviewed several clinician leaders to understand how hospital leaders can make medicine kinder, safer, and more reliable through promoting professionalism and accountability. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Dr. Craig Uthe, Medical Director of Physician Wellbeing at Sanford USD Medical Center in Sioux Falls, South Dakota.
Good morning and welcome to another podcast in the AHA's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and I'm joined today by Dr. Craig Uthe, Medical Director of Physician Wellbeing at Sanford USD Medical Center in Sioux Falls, South Dakota. Today we're talking about how hospital leaders can make medicine kinder, safer, and more reliable through promoting professionalism and accountability. To get us started, Craig, can you tell me a little bit about yourself and your experience?
Well, thank you, Elisa. It's my pleasure to be with you this morning. I'm a native of South Dakota, went to medical school at USD and did my residency at the University of Minnesota. And then after 5 years of being out about around the country, I came back to South Dakota where I've been a family physician for 25 years. In my 25 years, I received substance abuse and alcoholism, and then became involved with the state overseeing the physician health program that monitors healthcare professionals in recovery. And with that work, I started getting involved more in the administrative side at Sanford Health and kind of migrated into then becoming the medical director of physician wellbeing here at Sanford Health.
Tell us a little bit, how does professional accountability work in a rural setting in particular? There you've got smaller numbers of clinicians. They're often separated by great distances and certainly hard occasionally to recruit to some communities. How do you really encourage that professional accountability work?
Well, Sanford Health has 1,500 physicians scattered over a 300,000-mile footprint, and so that is a challenge. We are divided up into 4 regions, and in those 4 regions, we do have a structured orientation. And in that structured orientation, we do have a credo, a code of conduct. We have our mission, vision, and values statement. And in our orientation, we're very, very intentional in helping our physicians and our APPs understand what professionalism is, what the expectation is, and what we call personal well-being and what professional well-being consists of.
Wonderful. Can you tell me a little bit about that relationship between professionalism and wellness and well-being and where you've seen those two streams of work come together?
With our physicians and also our APPs, and actually extends out to the entire medical team that we have at Sanford, when we are talking about professionalism, we really talk first about the person's personal well-being. We at Sanford really believe that in order to take care of a patient, we really need to take care of ourselves first. And so we are concerned about a person's personal well-being, be that their physical, mental, spiritual, financial journey, whatever that might be, and to provide support in that venue. On the professional well-being side, there are expectations that we have for accountability and for ownership of the behavior that we have. The field of medicine is a safety-sensitive profession, and because of that, there are standards that we feel that we need to follow. And we have defined what does professional well-being look like. And so with that, we provide resources. We have physician leadership. We have department chairs. We have individuals who are there to provide kind of the direction, both in their modeling and in providing resources that help physicians stay maintaining professional boundaries and professional well-being.
So how do you help hospitals support those physician leaders in really promoting that professional accountability? What systems do you have in place?
So when it comes to professional well-being, we have identified ways to help our clinicians be accountable to the work that's being done. No one is perfect. We don't expect that. And so what we do is anytime that there's an unprofessional behavior that we see demonstrated by a professional, we reach out to those individuals. And we usually follow it within a clinician's department. So it's a person that they know, it's a person they respect, it's a person of authority that they have a relationship with, who they trust and who they will listen to. And so in that program, if there's an incident of unprofessional behavior, we will have that individual reach out to them, have what we call a coffee cup conversation with that individual, and see what's going on with that individual. The first thing we do is to ask ourselves, in a situation where we see unprofessional behavior, an example would be a physician maybe speaks loudly to and negatively to somebody that's a subordinate, an APP or a nursing staff. And we ask, what's going on with that physician? That was not a professional behavior. That was unprofessional behavior. Is that physician healthy? What's going on in that person's life? Because it's not uncommon for people to have bad days. And when a person's having a bad day, we want to know about that. Most of the time, our clinicians may not have the insight that was a moment where they were derailing or didn't notice that they were showing unprofessional behavior. In those settings, what we like to do is just repeat back what was observed to the clinician, and oftentimes that's all that's needed. An apology is made or insight is made. Maybe something is revealed about the physician's well-being where there's showing some overload or burnout. And if we identify burnout, we want to address that need. I think we underestimate times when bad behavior is shown by a physician, or there's some sort of negative behavior. If we see that, many times there may be burnout behind that. And so what we want to do is address the source of the problem, which would be the very nature of why that physician may be struggling in that moment. Occasionally, we will see patterns of unprofessional behavior as defined by our credo at Sanford. And when we see those patterns of unprofessional behavior, we are very, very intentional to reach out to that individual. We always want to show respect for every single employee at Sanford, and in a respectful way, we like to have people reach out who they know, who they trust, who have some experience in reaching out and addressing these behavior issues, because they are quality and safety issues, and look for ways that we can help that physician improve and change that behavior. And when we see patterns, oftentimes we're able to reach out to them, and just by almost like putting a mirror up for them, showing them what has been going on, we see self-correction. So often we are so busy in our lives, that's not an excuse, it's just the reality of the worlds we live in. Every physician is busy. And it's important to stop, pause, take a look at the behavior that we're exhibiting and say, is this the behavior that we want to promote in our organization? Most of the time, overwhelming majority of the time, it's yes, this is what we want to do. We want to give praises for that good behavior, for that professionalism that we show each and every day. And then when there are those slip-ups, when we have a day or an event that we have something happen that's just not thought to be in the best interest of the patient or our staff in the environment that we're in, we really want to reach out, take a look at that, and provide resources to our clinicians in ways that might improve that.
I love that you've really linked this to starting with that, making sure that the person is well and understands what their behavior is doing to the team around them. I think that's another way that addressing well-being really helps gel the team and bring it together, because just having one person who's burned out in a team very quickly can multiply. So I'm really glad that that's how you're addressing it.
I agree. No one is out there trying to behave in a way or practice in a way that's not going to be providing safety and good quality to our patients. No one is doing that. But interestingly enough, in our medical school education, we don't spend a lot of time in critical thinking, communication skills, and interpersonal relationship development. So when a clinician has an incident or something that happens, we really haven't received the education in the past that helps to develop those skills and notice those. And we're changing. We are now providing those resources to our physicians in a lot of the educational opportunities we have at Sanford Health.
if you had to go back and do this differently as you built a program around professional accountability and well-being, are there one or two things you would do differently and change up?
Personally, I think I would have become a little bit more involved on the administrative side of medicine early on. It's not uncommon for an atmosphere of we versus them, the physician versus administration to develop. That's some of the cynicism we see exhibited by physicians at times. And interestingly, that cynicism actually could be a symptom of burnout. And so I find one of the best ways to mitigate that is to get involved. One of the best ways, I think, to get involved early on in your career is to be a member of a peer review committee. I remember when I first got on a peer review committee at Sanford Health, it was the perinatal committee. And I was delivering babies at the time, and I found going through and reviewing cases of my contemporaries in a very objective, non-threatening, personal way. I found that to be very insightful for me and was the start of my journey down a world where it was collaborative and collegial with my administrative physician leader colleagues. Very helpful. Mm-hmm. A second thing that I wish I would have done earlier is, as a family physician who does a lot of work with substance use disorders, alcoholism, and then healthcare professionals struggling with addiction, I wish I would have been more interested in the interpersonal relationship development. I became certified in the Myers-Briggs type inventory assessment, and then a few years later after that, the Hogan assessment. And those two tools just gave me such an incredible insight and gave me an opportunity to reach out to my patient, first of all, in a way that I didn't have understanding before. And once I had done that, those are personality assessments that helped me look at problems, look at the lives of my patients from their perspective. And when I did that, I found that the patient became so much more interested and invested in getting better themselves. And when they found that I cared about them, it was amazing how much more impactful and effective I could be with the recommendations of treatment and care that I had for them. And then when I started developing my work with my colleagues in their professional wellness development, it's amazing how much more effective it is when you have insights into looking at from the perspective of that professional. I just found that to be so much more valuable in helping them to be successful in the work they had to do.
I think that makes a lot of sense. It sounds like you're really bringing that relationship back to medicine and really building those interpersonal relationships. I think that's very powerful in helping people. So to wrap us up, do you have a couple of key takeaways or learnings from your experience in promoting professional accountability that you'd like to share with our audience?
The first thing I would say is to show respect for the individual person that you're working with all the time. So I know for us here at Sanford Health, the first thing we do is like to step back and ask, how is the well-being of the person we're working with? Are they in a good spot? Are they well? What can we do to help them? And trying to develop the relationship so that you have authenticity and the vulnerability where there's going to be truthfulness and being able to help each other. That would be the number one thing. A second thing would be develop and train your own physician leadership. I think that that's really important to provide the skills that are essential in providing that professionalism, that accountability. And when you have it amongst each other with your colleagues, it just seems to have so much more impact. And I find when it's your own culture, where you have your own credo, you have your own values, you've worked through those, there is a trust that develops between colleagues that provides that impact that just seems to be that much deeper and richer when you can have colleagues work out the professionalism issues at that collegial level. Always very, very important. And then always strive for success with your physicians. So anytime that I work with physicians from my administrative leadership role, my goal is to always have that physician be successful, whatever that might be. So if it's leadership development, it's looking at the skills and talents that that individual has and says, what can we do? What resources can we provide you? What do you want to succeed in your career that we may be able to help you with that? And then secondly, if there's somebody that's struggling with something in their professionalism, how can we help you to see this differently so that maybe your scores or your whatever we are using as a metric to measure success in a person's practice, if somebody's struggling with interpersonal relationships, if they're struggling with staff members, if they're struggling with meeting metrics that we've identified in the system, what can we do to help you be successful in a positive method as opposed to being negative? And so we always try to stay on the positive side with that. So those are the things that I would say are the primary features we like to focus on in trying to develop our physicians.
That's wonderful. I think if we all kept respect, trust, and supporting each other in mind, it would be a greater world to work in. Thank you so much for sharing all the great work that you're doing at Sanford and for continuing to support our clinician leaders.
Well, I appreciate it. Thank you very much.